Hello, my name is Madison Cisco. I'm a physician assistant student at Jefferson University, and today I'm going to just be getting a little bit of your medical history. Before we get started, I just want to ask you some basic questions about yourself. Can you tell me your full name?
Taylor Dallas,
Okay. And when is your date of birth?
10/4/97.
Okay. And just so you know, I'm going to be writing down some notes during this interview. I don't want you to think I'm not listening. I just want to make sure I don't miss anything.
Okay.
Okay. And what gender do you identify as?
Female.
Okay. And I know you told me your birthday, but how old are you?
I'm 23.
Okay. And what ethnicity are you?
Caucasian.
Do you have a job right now? Are you a student or what's going on?
I'm a student.
You're a student? Okay. What school do you go to?
I actually go to Jefferson.
Oh, awesome.
Yeah.
Okay. And besides what you are here for today, how would you say your general health is? Have you had any major diagnoses over the last couple years?
Um, I have high blood pressure because I
Okay.
smoke.
Okay. Do you think there's anything else major besides that?
I think that's all.
Okay. And then just one more thing. Are you single, married, divorced, or widowed?
Single.
You're single. Okay. All right. Thank you so much for that. Now let's get into what brought you in here today. So, what was the reason that you're coming in today?
I've just been having really sharp pain in my chest. Like it feels like it's right in the middle of my chest, kind of. Sometimes it's a little bit towards the left, a little bit more when I breathe in and out. And I've just been kind of having shortness of breath along with that.
Okay. I'm so sorry about that. And how long has this been going on for?
Maybe like 2 weeks. It's been getting a little bit worse.
Okay. Okay. I'm so sorry to hear that. We'll definitely want to figure out what's causing that and get that fixed. So, you said it began about 2 weeks ago. And when it began, do you think, was it kind of gradual or did all of a sudden you have these symptoms?
It kind of came on all of a sudden, honestly.
Okay.
I was I went on a trip to visit my aunt and uncle and I was flying, and after I flew, I kind of noticed that it was harder to breathe and the pain was pretty sharp, honestly, and it hasn't really gone away. I just didn't really think it was that bad that I needed to go to the ER, but I definitely wanted to get it checked out.
I'm so glad you came in. That was definitely a good decision. I definitely want to try to figure out and, like I said, take care of this pain for you. Um, is there anything that's been making it worse these last couple weeks?
When I breathe in and out, like if I take a really deep breath in, it's pretty painful.
Makes it worse. Okay. Is there anything you can do that can make it better, make the pain not as bad?
If I just like lay down and don't move and try to just like take
Okay.
pretty shallow breaths, that usually
Yeah,
helps, but I know that's not the best thing
yeah,
to do.
that's really hard. Have you had any other symptoms kind of start with along with the shortness of breath and the pain with breathing? Anything else going on?
Not really. I mean, sometimes I kind of feel like I'm getting like a little bit lightheaded or dizzy just because I can't really breathe as well.
Yeah. Okay.
Especially if I'm like moving around a lot, but besides that, nothing else.
They're all kind of going together. Okay.
Yeah.
Have you had this happen before?
No, never.
Okay. And so you said that you have obviously pain when you're breathing and in your chest. How would you rate that pain on a scale of 1 to 10, 10 being the worst pain you've ever felt?
When I take a deep breath, I'd say it's about an 8. It's pretty bad. But if I'm just like laying down, it's probably like a 5.
Okay. Does the pain, could you point to where the pain is when you take a deep breath?
It's like a little bit towards the left side of my chest,
Towards
like
the
right
left
here.
side. Okay. And do you think that pain spreads at all or kind of just stays right there?
It kind of stays right in that area. I mean, sometimes it feels like it's in the middle of my chest, but mainly in that left area.
Okay, thank you. And does the pain, I know you're telling me, it's obviously worse when you're taking deep breaths. Do you notice any change at all with the time of day? Is it worse in the morning or the night or anything like that?
It feels kind of like the best when right when I wake up, just because I am like relaxed and laying down. But
Yeah.
then when I get up and I start like doing like brushing my teeth and brushing my hair, then I kind of notice it's getting worse because I'm up and about and like moving more.
Okay. All right. Thank you so much for that. Now I'm just going to ask you some questions that are similar to what we've been talking about. For the most part, it's going to be some yes, no questions. But I just kind of want to pinpoint what exactly is going on. Okay. So first I'm going to ask, have you had a persistent cough at all with these symptoms?
No, I don't have any cough.
And I know you haven't had a cough. Have you had any sputum or mucus coming up at all? Okay. Have you had any shortness of breath? Yes, obviously, that's why we're here. Okay. Have you had any wheezing with your breathing?
I don't think so.
Okay. Have had pain. Have you ever had a chest x-ray?
I don't think I have.
Okay. Do you know if you have asthma?
No, I don't.
Okay. And now I'm just going to ask you if you've had any specific illnesses. Have you ever had bronchitis?
Yeah, when I was little, I had that.
Okay. Do you know how old you were when you had that?
I think I was like 6.
Okay. And do you know, did you have any complications with it?
No, I think I was fine after I took my
Okay.
medicine.
Okay, I'll mention that again later.
Okay.
Um, have you ever had emphysema,
No.
pneumonia,
No.
tuberculosis?
No.
Okay, now I'm going to ask you a few more yes, no questions that are more about your heart. Have you ever had any general heart trouble that you would say?
No, besides this, it just
Besides-
kind of feels like it's my heart because it's towards the left, which
Yeah.
kind of makes me a little worried, but
And you said you do have high blood pressure.
yeah,
Have you ever had rheumatic fever?
no.
Do you know if you have a heart murmur?
No, I've never been told that.
Okay. And you're having chest pain right now with the
Yeah.
breathing. Have you ever had any chest discomfort, regardless from what's happening right now?
No, not before the past 2 weeks.
Okay. Have you ever had heart palpitations when your heart beats really fast for no reason?
No, I don't think so.
You are short of breath. Do you need to, when you sleep at night, do you ever put pillows behind you to sit upright as you sleep?
No. I mean, it kind of feels better if I'm flat right now, so I don't really do that.
Okay. Have you noticed any swelling in your hands or your ankles or your feet?
I don't think so, no.
Okay. And do you know if you've had any electrocardiograms or any kind of cardiovascular tests done?
No.
Okay.
Nothing.
And now I'm going to ask you some questions about your neck area. Have you ever had any swollen glands in your neck?
Um, yeah, I feel like when I've had what's it called? Strep throat before, my glands were a little bit swollen when I had that, but
Yep. Yeah, that's pretty normal with strep throat. Have you ever had any goiters or big lumps on the front of your neck? Okay. Do you ever have any lumps in your neck?
no.
Any neck pain?
No.
Any neck stiffness?
No.
And now I'm just going to ask a few questions about your breast area. Have you ever found any lumps in your breasts?
No.
Have you ever had any pain in your breasts?
No.
Have you had any recent discomfort?
No.
Have you had any nipple discharge?
No.
Okay. And do you ever use self-examination practices on your breasts?
Oh yeah, I do sometimes when I'm in the shower.
Okay, that's great. Okay, thank you so much. I know all those yes, no questions can be hard sometimes to get through, but you were the best with that. Okay. So now I'm just going to move on to asking some more general questions about your history. And all of this is just to try to narrow down, what could be causing this. So first, I'm just going to ask you about your medications. Are there any medications either prescribed or also over the counter that you are taking?
I take birth control
Okay.
and I take an allergy pill every night.
Okay. Do you happen to know the name of your birth control?
I think it's called Larin, Larin.
Okay. And how much of that do you take?
I don't know. I just take one pill each night, but I don't know how much it is.
Okay. That's all right. One pill by mouth.
Yep.
And do you know what allergy pill you take at night?
I take Zyrtec.
Okay. How come you take that?
Sorry, what did you say?
How come you take Zyrtec every night?
Oh, I have seasonal allergies, so I just get like itchy eyes and itchy nose and runny nose. Nothing
Okay.
worse than that.
Yeah. Yeah. That can really help to sleep when you're having those symptoms. And do you
Yeah.
know how much of that you take?
I think it's 10 milligrams.
Okay. And you just take one of those by mouth before bed?
Yeah.
Okay. Any other medicines that you're taking?
Nope, that's all.
Sorry about that.
That's okay.
And so you said you have seasonal allergies, right?
Yeah.
Do you have any other allergies?
I'm allergic to sulfa medications.
Okay. Do you know what happens when you take those medications?
Yeah, I get like hives all over my face and my neck.
Okay. I'm
Just
sorry
really
about that.
itchy and uncomfortable.
Yeah, that sounds very uncomfortable. I'm sorry. Well, we'll make sure not to give you any of those. Make sure to write that down in your chart. Do you know the last time you had a reaction to those medicines?
I think I was a sophomore in high school, so maybe like 6 years ago,
Okay.
7 years ago.
Okay. And do you have any other allergies that you can think of to food, to environmental, to medicine, anything?
No.
Okay. And then I just need to ask you some specific allergy questions just to make sure to be safe, some things that, we use in a hospital setting. Do you know if you're allergic to latex,
No.
iodine,
No.
chlorhexidine?
No.
Okay, great. Now I'm just going to ask you a little bit about your past medical history. I'm going to start all the way back when you were a child. I know you already told me a few things, and I said we were going to talk about them a little bit more. So now is when I want to kind of get into them. So I think you mentioned that you've had strep throat before, right?
Yeah.
Do you know how old you were when you had that?
I've had it like 5 or 6 times, so I had to
Oh,
get my tonsils
wow.
out.
Okay.
But the last time I had it was probably like middle school.
Okay. And I know you've had that a lot of times, which obviously can be really hard and concerning. Do you have any, additional or abnormal symptoms or complications when you have strep, or is it kind of just the typical strep symptoms?
I just get like a fever. My throat just hurts really bad, and sometimes I like throw up because I get really nauseous with it. Um, but I haven't had it since I got my tonsils
Yeah,
removed, so that's good.
okay. Oh, you got them removed. Okay,
Yeah.
perfect. Then that should take care of that, hopefully. And then you also said you had bronchitis, correct?
Yeah.
You know
When I
how
was,
old you were when you had that?
I think I was about 6. I think I was in first grade.
Okay. And did you have any complications with that, or did you recover?
No, I was fine after that.
All right. Okay, great. Any other childhood illnesses?
No, I think I was pretty healthy.
Okay, great. Now I just need to ask you some very specific ones. Just yes, no, you can run down the list. You probably didn't have any of these, but we just need to make sure of it, okay?
Okay.
Measles,
No,
mumps,
no,
rubella,
no,
whooping cough,
no,
chickenpox,
no,
rheumatic fever,
no,
scarlet fever,
no,
polio,
no,
diphtheria,
no,
and did you have any psychiatric disorders as a child?
nope.
Okay. Okay, great. Thank you so much. So now I want to ask you a little bit more about illnesses that you've had as an adult. So this could be, I guess 18 or older, but really just any time in the last years, that you would say would be an adult illness.
Okay. Um, I'm trying to think. I was diagnosed with high blood pressure,
Oh, yes. Okay.
and they think that's because of my smoking.
Nothing. Okay.
And let me think. No, besides that, nothing.
Okay. Do you know when you got diagnosed with high blood pressure?
I think it was about 2 years ago.
Okay. And you're you're on medicine for it now. Did you have any other kind of treatment done for that?
I'm actually not on medication.
Okay.
I was originally supposed to be, but I told them that I preferred to try to manage it like naturally because I didn't want to be on medication this young.
Yes.
So I've just been trying to exercise and eat healthier and limit my sodium intake. But I haven't gotten it checked recently, so I don't really know if it's helping or not.
Okay, well, that's something that we'll make sure to check before you leave today.
Okay.
Hopefully what you're doing is working. I mean, all of that is great, and that's definitely a way to lower your blood pressure. You don't need to be on medication, but we want to make sure that it is lowering, and if not, then, we want to talk about how we could possibly fix that.
Okay.
Okay. And no other illnesses besides the high blood pressure, and obviously, what brought you in today.
No, nothing else.
Okay. Now I am just gonna, once again, list off some very specific disorders, and you can just say yes or no to them.
Okay.
Diabetes,
No,
tuberculosis,
no,
hepatitis,
no,
coronary disease,
no,
lung disease.
no.
Sorry, something just popped up.
Okay.
COPD or asthma,
No,
kidney disease,
no,
thyroid disorder,
no,
HIV,
no,
cancer,
no,
hepatitis,
no.
and blood clots.
No.
Okay, so now besides illnesses, I want to ask you about any accidents or injuries you've had.
I broke my leg
Okay,
when I was in 8th grade because of cheerleading.
okay. And did you get that casted?
Yeah, I broke my fibula, and
Okay.
after I think it was just 8 weeks of in a cast, and I was fine after that.
Okay, that's fantastic. Yeah, that can be a really hard break, but I'm so glad that, it all healed up. Have
Thanks.
you had any other accidents or injuries?
No, nothing.
Okay. And besides, when you would have gotten casted for that break, have you ever been in the hospital for anything else?
I was when I got my tonsils and adenoids removed.
Okay. So you were in the hospital for your leg and then for your tonsils. Anything else?
Actually, it was kind of like I don't even know how to explain it. It wasn't a hospital, it was like a surgery center.
Okay. Yeah, no, that makes sense. Do you know what hospital you were at for either of those?
Um, I think the leg casting was at Reading Hospital,
Okay.
and then the tonsils was, I remember it was by the Berkshire Mall. I
Okay.
don't remember what it was called. I remember my doctor's name though.
Okay.
Dr. Watson. That was my doctor.
Okay, great. Thank you so much. And did you have any complications with your tonsil surgery, or are they all right?
Nope, they're good now.
They're all gone, right? Perfect. Okay. And any other surgeries besides the tonsils?
No.
Okay. So now I want to ask you about immunizations. Do you normally get vaccinated?
Yep, I think I've gotten all my shots.
You think you're up to date with everything? I
Yeah.
know a lot of the times schools will require them. Are
Yeah.
there any vaccines that you know of that you definitely don't get?
No, my parents have always given me everything.
Yes.
So
Okay. Okay, that's fantastic. Do you get a flu shot?
yeah, I just got mine about a week ago.
A week ago. Fantastic. Okay, so I'm gonna assume you have all of the normal vaccines. That's something, obviously, if it was an issue, I can double check with your chart. Do you know if you've ever had the pneumococcal vaccine? It's for pneumonia. It's not very common.
No, I don't think I've had that actually.
Okay. And like I said, that's something I can double check for you as well.
Okay.
Okay, so all good with vaccines. Now I'm just going to ask you about some different screenings that are also important for your health. You may or may not have had them. Have you ever had a mammogram?
No.
No. Okay. Have you ever had a colonoscopy?
No.
Have you ever had a pap smear?
Yeah, I get one every year.
Okay, great. Do you know when your last one would have been?
Actually, it was this past summer.
Okay. And have you ever had any atypical findings?
No.
Okay, great. Have you ever had a TB skin test?
Yeah.
Yes. Okay. Do you know when you had that?
I had it in May, I think it
Okay.
was.
Okay. And were there any atypical findings with that?
Um, Actually, yes, kind of, but they think it was just a false positive.
Okay.
So I had it redone and then it was normal the second time. So I
Okay.
actually did, you asked me about the chest x-ray earlier. I actually did have to get a chest x-ray. I forgot about that.
That's
Um,
okay.
but everything was normal with the chest x-ray. So yeah, they said they think it was just a false positive.
Okay, great. Yeah, that definitely happens sometimes. And do you get your cholesterol checked?
I don't think I ever have. I've
Okay.
gotten blood drawn before, but I don't. My doctor's never said anything
Yeah.
specifically about cholesterol.
Yeah, if there's not any risk factors, then a lot of the times we will wait till you're older, so that's totally normal.
Okay.
And then do you know if you've ever had a fecal occult blood stool test?
No, I have not.
Okay. All right, well, now I'm going to move on to asking you some very specific women's health questions. I'm sure you've had these questions before the gynecologist, but like I said, we're just trying to get, a total picture of your health right now. So it's really important to ask these things as well. So first, I just want to start off by asking about your menstrual history. Do you know how old you were when you got your first period?
Um, yeah, I just turned 12.
Okay. How long is your typical period?
It's only about 4 days.
4 days, okay. And then how long would you say is between each period?
Um, it's probably like 28 to 29 days.
Okay, great. That's great. Um, and how would you describe your flow? Light, medium, or heavy?
It's only heavy for one day, and
Okay.
then it's pretty like I would say medium.
Okay. What day is normally heavy?
The second day usually.
Okay. Do you know when your last period was?
It was at the end of September.
Okay.
So actually, maybe it was more towards the middle of September, maybe like 2 weeks ago.
All right. That's fine. Um, okay. Have you ever not had your period unexpectedly?
No.
Have you gotten it pretty much every month?
Yeah.
Okay. And are your periods ever painful?
I mean, I get like the typical cramp before and probably like 2 days before, and then my first day it's pretty painful, but it's nothing like compared to some of my friends.
Yeah. Okay. When you get those cramps, do you take anything?
Usually I can like just rest and I try not to take medicine, but if it gets bad, I sometimes just take Advil.
Yeah. Okay. Is it like concerning to you? Like, does it keep you home from going to work or school or anything like that?
No, I've always been okay, just trying to push through.
Okay. Yeah. Okay. And you said you had your last pap smear this summer, no abnormalities. And do you have a history of any sexually transmitted infections?
No,
No? Okay. Have you ever been pregnant before?
no.
Okay. Okay, thank you so much for all of that. Now I'm just going to ask you some of your family history because once again, sometimes things can run in families and it just once again gives us a better picture of your own health.
Okay.
So first, I just want to ask about anything that you know of that you think runs in your family.
Um, no.
No? Okay, that's great. Okay, is your paternal grandfather living?
Yes.
How old is he?
Um, he's 74.
Okay, and does he have any health conditions that you know of?
He was just diagnosed with AFib actually,
Okay,
and he had melanoma like probably like 30 years ago before I
okay,
was born.
okay.
Um, but he recovered fully from that. Besides
Okay,
that,
good.
he's healthy.
Okay. Okay, now we're actually all out of time for today. Thank you so much for coming in. Hopefully we'll get all of your pain figured out and you were a wonderful patient.
Thank you.
Now let me